Okay, yes, we're very happy to have you today here today for this great session on disability documentation. We're very happy to have a guest facilitator, Dr. Jens Serrantino-Cox. Dr. Serrantino-Cox is president-elect of the Coalition for Disability Access in Health Science and Medical Education. She's currently a consultant with Meeks Company, a consulting firm for disability-related issues in higher education. She's retired from her role as director of Disability Services Center at the University of California, Irvine, and has co-authored 2 chapters in the Guide to Assisting Students with Disabilities Equal Access in Health Science and Professional Education. So very much looking forward to a brief presentation for her and her facilitation of our discussions. All right, I hand it off to you now.
Well, thank you very much, Dr. Souza. I'm so pleased to be invited to join all of you today to talk about disability documentation and open up the discussion about that. And so I was hoping we could begin with some fun stuff. So as Dr. Souza mentioned, I am a higher education consultant. What I spend my time doing in retirement is working with universities that have health science programs, and even some community colleges with health science programs, to help them work around accommodations predominantly in the clinical lab, simulation lab settings for students with disabilities. It seems to be a very nuanced field, and most disability resource professionals are very good at providing accommodations for the undergraduate student, for the typical student who needs notes or test accommodations, extended time. But when it comes to the clinical setting, then it is a little bit more challenging. So let's start off with, as I said, the fun stuff. And disability service providers see a wide range of documentation, but the most interesting thing is the ADA, the Americans with Disabilities Act as amended, does not require written documentation in order to receive accommodations. So this might be surprising to some of you, and you might ask, well, why then are health science programs asking for documentation? And there's a lot of reasons that schools do so. And one of them is just so that they have uniformity of processes for students with disabilities, to make sure that every student with a disability is getting treated equally. They also require documentation because they know that students are going to be needing documentation when they request accommodations on licensing exams. And many schools want to attempt to have some consistency between the documentation they require and the documentation that's needed for those exams. And then again, some states perform audits of disability services processes. So those are some of the reasons why schools, health science programs still require documentation. So what documentation is the disability resource professional looking at? Well, a student might come in with military documentation that gives percentages of disability. They might have PTSD, and that is at 40%. And they might have hard of hearing at 12% because of being around so many blasts. And so it's very complicated to make accommodations decisions based on that. But between the DD-214 information and the student sharing their needs and their requests, the disability service provider can use that. Most people are familiar with Ed.D, learning disability, and ADHD documentation, the psychoeducational evaluation, which looks at IQ and achievement scores to determine areas of deficit. Disability resource professionals also look at neuropsychological exams for autism spectrum disorders, psychological disorders, and ADHD. The audiogram is something that most disability service providers really need help in interpreting. They're looking at a table with lines going up and down and trying to figure out, well, how does that translate to the classroom? Vision evaluations, letters from healthcare providers, and two other forms of documentation are observation. So I might use my own personal notes if I am meeting with a student who is severely visually impaired, a student who might be using a guide dog, a student who is in a wheelchair. I wouldn't necessarily, during my time at UC Irvine, require that person to give me any written documentation because it was obvious what the disability was. And also self-report. This one is a little bit tricky, but it's one that I use frequently at Irvine. For example, if a student was in a situation where they had been involved with the Campus Assault Resource Center, and they were suffering from some type of domestic violence or assault, I would take the report of the psychologist working in that center and then meet with the student and determine accommodations, whether they be temporary accommodations or long-term accommodations. So this is to say that the disability resource provider is looking at many, many types of different documentation. And this is not an exhaustive list. There's other forms of documentation as well. We would sometimes get a prescription pad note or chart notes. And so the most important thing is what in the world is the disability resource professional looking for? I don't want to really go there yet, but anyway, we're looking for is the person who completed the documentation, credentialed, licensed, qualified to diagnose someone with that particular disorder. For example, is a chiropractor giving a psychological diagnosis? That wouldn't be appropriate. We're also looking for the student's diagnosis, although we don't have to have the actual diagnosis, but what we do need is the severity and the predicted course of the diagnosis. We want to know how the diagnosis was assessed. We want to know the extent to which it is going to interfere or impact the student in an academic environment. We want to know what accommodations the healthcare provider is recommending. We have an obligation under the Disabilities Act to consider any accommodation that the healthcare provider is recommending. We're not obligated to implement that exact accommodation, but we're obligated to consider it. And we oftentimes, when we get some of this documentation, we need to get a little bit of clarification with the healthcare provider. And so we would ask the student for permission to speak with their healthcare provider and ask a few clarifying questions. So moving on, one of the most important things is how can the process for reviewing documentation and implementing accommodations on your campus be improved? Well, there's a number of things that I'll mention, and you'll have some opportunity to discuss more in your breakout groups. But the disability resource information should be readily available at many locations, not just the disability office. It needs to be on the homepage of the campus website. information about disability services, or at least a link to getting to disability services. Information should be available on the health science website, in the technical standards, in the student handbook, on the admissions pages, in the acceptance letters, and other relevant locations. If students get that information from the get-go of where to go, rather than having to search a website or ask the question of where do I go, it really improves the process. It's really important that the process is not burdensome. Not burdensome has to do with the Disability Resource Office requiring specific types of documentation. Schools have programs have the authority to determine the documentation they will accept, but they can't make it so burdensome that it is a hindrance to that person applying for accommodations. And burdensome has to do with the cost of the documentation, the time it takes to keep going back and getting more. Those types of things have not been viewed well by the Office of Civil Rights and in many legal cases. The Disability Resource Office needs to respond in a timely manner. This is really key. So many accommodations, or the majority of accommodations, can be implemented almost immediately. Things like getting note takers or establishing extended time on exams. Those are very implement, but there's other accommodations that take far more time. Having books translated into Braille, or alternate format, or training a student how to use a new type of software. Those might take additional days or weeks to get put in place. So having that information readily available before the student even starts the program is so important, and getting in contact with disability resources so they can start the process really early. Many programs have elected to have health science program liaisons. So that liaison is connected with the Disability Resource Office. And whenever a student is needing a unique accommodation, the DR professional can reach out to the program liaison, discuss the accommodation request, and figure out if it is a reasonable accommodation. Having a quick conversation like that, and maybe having pulling in a couple faculty members or the dean sometimes is really helpful in making sure that that accommodation is put in place right away. It's really important that faculty understand their role in the process of implementing accommodations. Faculty, of course, are responsible for making sure certain accommodations are put in place. Some faculty proctor their own exams. Most schools have somebody else organizing that from the disability office or a testing center. But more than that, one of the greatest pitfalls that I've noticed with faculty is in their profession as a healthcare provider, they sometimes cross the line into not being the educator, and instead taking on that healthcare professional role and trying to help the student, and maybe help the student with an accommodation. And that is a danger zone. And that can really lead to problems for the university down the road. So it's important for faculty to refrain from trying to implement an informal accommodation, and instead refer that student to the disability office. Sometimes faculty notice that a student is having academic difficulty. if that student has never mentioned anything about having a disability, the faculty member should just refer that student to academic support services. But if there is a sense or it's been implied that there's a disability, then the faculty should refer that student to disability resources. And it's really best to do that in writing, to send a notification to the student and to someone from the disability resource office saying, I want to introduce you to this student who has expressed these difficulties, and so that that disability resource person can reach out to them right away. And lastly, students need to understand their role. Students need to be informed from the get-go that they have a role and responsibility in obtaining their accommodations. Of course, they have to go to the disability service office, they have to disclose, but sometimes there's other things. They might need to notify the disability office at the beginning of each semester which class they want certain accommodations in. This is especially important when alternative text is needed or interpreters are required, captioners. So there's many facets to improving the process, and each person has a role in making sure that it goes smoothly and accommodations happen on time. Talking a little bit more about documentation, there's a huge documentation conflict when it comes to what I want to accept at the university or the program level and what I can use to implement accommodations and what licensing boards require. So I thought I would just go to this link very quickly, and I know it's going to be a little bit complicated.
The link that Dr. Serrantino-Cox is referring to is a specific webpage on the USMLE Service Transition Hub website. You can find it in the description or displayed on screen.
But just for example, this is what is required for attention deficit disorder. Here is the scope of what is required by NBME. So they have very comprehensive, they're requesting very comprehensive documentation. And when we're looking at documentation at the program level, we want to get that student started right away. And we know that their documentation might not work, might not be accepted by the licensing board. And so it's very important for the disability resource professional to work with that student from the get-go on, I'm accepting your documentation, it's working for us and these accommodations you're requesting, but it's not going to be enough for NBME or NCLEX or some of the other licensing boards. So let me start right now with a list of the things that you need to start gathering over the next 2 years so that you can be ready. And I'll give you a packet with a timeline so that you can, every month, you can start working on this little by little rather than waiting, a month or two before you want to apply for accommodations. So I've given you a range of information regarding disability documentation, but I think now it's time for you to have some conversations about what can happen on your campus to improve the process and support students with disabilities. And I believe those questions are in the Google Doc. So I will stop sharing my screen.
Great, thank you so much. Thank you for that fantastic presentation. So much to think about, and exactly, there's just so much that's not transparent for trainees and students, and the points you made about making sure that this information is readily available, not just somebody who's having to dig into the disability resource provider's kind of like website, but like upfront. So like somebody said, like many times people just don't even know that they can have access to accommodations or what kind of accommodations they might need.